Hey everyone, welcome to today's Explainer. I'm really excited to get into this one because honestly, we're looking at this super fascinating intersection between high stakes medicine and human psychology. We're going to break down a pretty gripping medical mystery. You might actually recognize it from the TV show House MD, and it reveals a profound, really common mental trap that catches even the absolute smartest experts completely off guard. We'll map the whole case out so you can see exactly how a single blind spot can completely derail an investigation, and more importantly, how we can all avoid it. So let's just jump right in.
Okay, so picture this. It's a chaotic, super fast-paced scene on a high school lacrosse field. You've got a completely healthy 16-year-old athlete who takes this sudden, really hard hit to the head right in the middle of a game. Now, it's a rough sport, right? Collisions happen. So naturally, everyone, from the coaches to the medical staff, immediately focuses squarely on that impact. It just seems like your textbook sports injury. Classic cause and effect. But as we're going to see, sometimes the most obvious answer is actually a wildly dangerous distraction.
Just take a look at how this timeline unfolds, because this is where an ordinary injury just rapidly spirals into a total nightmare. At minute 1, we have that standard head trauma. But by hour 2, the boy develops diplopia. That's double vision. Fast forward to night 1, and what should be a simple concussion escalates into terrifying night terrors and severe hallucinations. And then, by week 1, we're not just looking at a slow recovery, we're seeing massive personality changes and this progressive, virtually unstoppable neurological deterioration. I mean, this kid's brain is rapidly failing. The initial assumption of a simple head hit it can't explain the sheer terror and the speed of these symptoms anymore. The stakes are literally life and death here.
Now, what's really interesting about this is how it challenges everything we just assumed. This quote, delivered by the famously cynical but brilliant Dr. Gregory House, is kind of the critical hinge of the whole story. While every other doctor is just frantically trying to figure out how a lacrosse collision caused hallucinations, House steps back and asks this one paradigm-shifting question. Are we actually treating the trauma, or are we just blaming the trauma for something entirely unrelated? Basically, he's asking, is this head injury actually the cause, or is it just this massive, incredibly loud coincidence?
All right, moving into part 1, the suspects, the differential diagnosis. So that brilliant question pushes us right into the medical detective phase. The doctors have to basically wipe the slate clean and pull together a differential diagnosis. They line up the usual suspects, the logical diseases that could make a brain shut down like this, and systematically put them to the test. Let's walk through the possibilities, because it's super revealing. The team is meticulous. First up, concussion or hemorrhage. Fits the recent trauma perfectly. But look at the exclusion reasons. The brain imaging is completely normal, and concussions don't cause progressive myoclonic jerks and hallucinations. So boom, crossed off. Next, multiple sclerosis. It definitely explains the double vision. But MS simply doesn't progress this violently fast, and steroid treatments completely fail. Crossed off. Viral encephalitis? Fits the altered mental status, but the spinal fluid is totally clear. A brain tumor could definitely cause focal deficits, but again, the MRI shows zero masses. And finally, a toxic or metabolic disorder would explain the deep confusion, but the lab workup comes back completely negative. Every single logical medical suspect just completely fails the test.
Moving on to part 2, the turning point, the overlooked clue.
At this point, the team has officially hit a terrifying dead end. The patient is rapidly slipping away, the tests are giving them absolutely nothing, and the standard medical playbook is totally exhausted. But right here, in the darkest moment of the investigation, this seemingly mundane conversation changes literally everything. The boy's father adamantly insists that his son received every single one of his childhood vaccinations. But then, a hidden clue emerges from the family history. The boy was adopted. Instantly, the ground shifts. Because the adoptive parents vaccinated him when they got him. But because of the adoption, his early biological vaccination history, what happened in those very first years of his life, is suddenly entirely unknown.
And this brilliantly illustrates the massive, glaring blind spot that had completely obscured the true diagnosis. On the one hand, the assumed history was a fully vaccinated, perfectly healthy teenager who just took a bad hit to the head. But the actual reality? He's an adopted child with an unknown, completely unverified early medical history. This totally changes the landscape of the investigation. The doctors had ruled out certain diseases specifically because they believed the boy was immunized against them. Without that guarantee, some really old, terrifying suspects suddenly walk right back into the room.
Which brings us to part 3, the true culprit, SSP. With that adoption clue unlocking the patient's past, all these bizarre, unconnected pieces of the puzzle suddenly snap into this perfect, horrifying alignment. The negative MRIs, the failing brain, the hallucinations, it all points to a shocking, exceptionally rare culprit. The diagnosis is SSPE, or subacute sclerosing panencephalitis. It is a rare, progressive, and fatal complication of the measles virus. Because the boy wasn't vaccinated in his earliest years, he caught the measles. But here is the truly terrifying part about SSPE. It doesn't strike right away. It's a delayed complication that happens years, sometimes up to a full decade after the initial childhood infection.
Let's actually trace the stealthy, fatal mechanism of this disease step by step. Step 1. The unimmunized infant gets the initial measles infection and seemingly recovers. Step 2. The virus physically hides. It lies completely dormant in the brain tissue for years. Step 3. Suddenly, as a teenager, the virus reactivates, causing this rapid cognitive and behavioral decline, which explains the night terrors and personality changes we saw. And finally, Step 4. Myoclonus, those involuntary muscle jerks, and total neurological deterioration. The lacrosse hit, it had absolutely nothing to do with it. The trauma merely happened to occur at the exact same time the dormant measles virus decided to wake up and destroy the boy's brain. Talk about a crazy coincidence.
And finally, part 4, avoiding the trap, the psychological lesson.
It's an incredible medical resolution, for sure. But to fully appreciate this explainer, we really need to pivot from the specific medical mystery of SSPE to the broader, highly applicable psychological takeaway. What happened in that hospital room wasn't just a failure of medical testing, it was a failure of human cognition. The medical team fell victim to a really dangerous mental trap called anchoring bias. This is a cognitive flaw where an individual focuses way too heavily on the very first piece of information they receive when making all their subsequent judgments. The lacrosse injury was just so loud, so obvious, and so visually dramatic that the doctors metaphorically dropped a massive anchor on it. Every single symptom that followed was viewed exclusively through the lens of that head trauma, making it literally impossible for them to see anything else. So the crucial point is the stark contrast between the distraction and the reality. On one side, you have the distraction, a glaring, highly visible coincidental event like our sports collision. And on the other side, you have the reality, a silent, true underlying disease like SSPE that's been brewing for years. Anchoring bias essentially blinds us to reality because the distraction is just so incredibly compelling. It shows that even the smartest medical experts in the world can be completely derailed if they allow a mere coincidence to dictate their logic.
Let's bring this all together by summarizing the core clinical pearls we've extracted from the source material. First off, strictly avoid anchoring on the obvious diagnosis just because a trauma recently occurred. Second, and this is a highly specific medical one, rapidly progressive neurological decline paired with myoclonus should always raise suspicion for SSPE. Third, you absolutely must actively verify medical and vaccination histories. Take special care with adopted patients where assumptions can be incredibly dangerous. And finally, the ultimate takeaway. Always remember that loud, immediate coincidences are the ultimate distraction from slow-moving, true underlying problems. Applying these structured rules is precisely how you prevent catastrophic errors.
We've seen how anchoring on a simple lacrosse hit almost cost a patient their life by hiding a decades-old virus. The source material teaches us that our brains absolutely crave the obvious answer, right? The easy cause and effect. But as we've learned today, the loudest event is rarely the true root cause. So I want to leave you with this final, provocative thought to take with you. Look at your own decisions, your own troubleshooting at work, or even in your personal life. What obvious head injury are you currently staring at, and what deeper, real problem is it blinding you from seeing? Thanks so much for joining me on this explainer. Keep questioning the obvious, and I'll catch you next time.